Doesn't my psychiatrist understand I can't even get out of bed? What do they think, that I'm not trying hard enough? Do they think I don't want to do more? It's literally a struggle to get out of bed and take a shower and have breakfast in the morning. As a psychiatrist myself, let me just stop by saying that these are all really, really valid complaints. Sometimes when a person is depressed and we're trying to encourage them to do more, it can sound invalidating, as if we don't understand the depth of what they're going through. Here's how I think about it when I'm working with patients. First off, even when depression is so severe that you've lost all hope in yourself, it's my job to hold the hope for you. Even when the depression is so severe that it seems to have robbed you of all hope and motivation, my job is to help hold that hope. But here's where I think we go wrong. Sometimes we don't realize how small a victory we need to start with. Yeah, it would be great if you went out and ran a triathlon, but as you say, it's hard to even get out of bed. One of the most important skills that I learned, and it came through tons and tons of feedback in my residency, I learned to celebrate the smallest possible wins. If it took my patient 4 hours to get out of bed on Saturday, we need to celebrate that it only took 3 hours on Sunday. If they haven't worked out in 6 months, we need to celebrate one push-up. If they've never been able to fully do a push-up, we need to celebrate the attempt at a push-up that went completely wrong and didn't work. Behavioral activation starts with feeling those little tiny wins. Otherwise, we fall into this trap of setting goals that are too big that the person is bound to fail at from the depths of depression, and that only serves as fuel to reinforce those negative thoughts, those ideas that I can't do it and I'll never get better. Which is why one of the important skills in therapy is being able to deconstruct these bigger and longer term goals into the smallest possible achievable thing that a person can do from within the depths of depression. Sometimes it's not even a behavior, sometimes it's challenging a thought. But even from those humble beginnings, tremendous recovery and healing can occur. It's not about me feeling like the best doctor ever because I managed to cure your depression. That's not how it works. It's about being willing to sit in suffering with somebody, to be there step by step to highlight the next best step forward, to celebrate the little wins as someone undergoes the process of healing. Doctors are not curers, they are teachers. At least that's how I think about it. But here's my question to you. If you've struggled with depression, or if you've worked with patients who had depression, what do you think is the most helpful thing for a doctor to do to help someone reclaim their sense of ability? I think this is a very important conversation, and I look forward to continuing it with you in the comments.